And there we go. Started the recording, and you're going to talk about the SNAP program and all some of those new fun things are happening.
They're not fun. Some of them are new. So good morning, everybody. My name is Kimberly Rausch. I'm the Associate Director of Policy over at DHS. So we call it many different things. We refer to it at DHS as HR1, but this is also known as the Reconciliation Act or the big, beautiful bill. I kind of choke on those words when they come out of my mouth. The changes that were implemented and signed by our president on July 4th. So what DHS is in the process of doing is we are trying to meet the federal expectations of these changes. We're trying to weigh that against not putting harm on Rhode Islanders, but also not causing harm to the federal program. So what I'm going to walk you through right now are the upcoming changes specific to the SNAP program. So SNAP is Supplemental Nutrition Assistance Program. It's formerly known as food stamps. I'm going to refer to it as HR1. It's just easier for me. It's what the state's been calling it. And we're really going to dive into the SNAP impacts. Now, I'll try to do this to the best ability with kind of that lens of taking care of our elder or maybe our disabled population across Rhode Island. I have a decent sized deck here. Some of this goes more into like the administration and how we're going to do this stuff at DHS. And some of it really speaks to how the customers are going to be impacted. There's a little bit of both here. So I'll try to go through it to the best of my ability. If there are questions, I'm very informal. I'd like you to ask them. I do not have good visibility if somebody has a hand up. So Deb, if you can help me out with that, I'd really appreciate it, or others. But I'm happy to answer questions to the best of my ability. So through HR1, this is a very busy slide. There's a lot of things on here. We kind of tried to bucket the changes that are going to be happening to SNAP. And so we did it through how HR1 was written. They have all these numbers, 10101 and all those things. Some of these have big impacts. Some of these have small impacts. Some of them are impacted immediately. Some of them are down the road. So it's really hard to kind of give a clean spectrum of kind of what has happened here. In general, the good news is that through HR1, if a household contains somebody that is elderly or disabled, for the most part, their benefits should stay the same. Now, it doesn't mean that there aren't going to be some changes, and it doesn't mean that things might look a little bit different or we might ask about different things. But for the most part, HR1 did try to keep elderly or disabled individuals on SNAP relatively safe. And I say that, and there's a lot of asterisks to that statement. But that's kind of the good news. But in Rhode Island, with our cost of living and how expensive housing is, many of our families might have an elderly or disabled member, but they also have a whole bunch of other people residing in that household, right? There could be 2 or 3 generations living in that household altogether. So when we look at what's up on the screen right now, right, we've got that thrifty food plan. So that's how the federal government may increase SNAP over time, right? So we do an analysis on how much food is costing us and how much the average worker is bringing home. So that thrifty food plan, what changed in HR1 is that they're not going to do any big changes to SNAP coming down. So we might have that yearly dollar increase here and there, but any big bump in SNAP, and we recently had one in 2022, SNAP went up for some of our customers like $30 or $40 a month. That's not going to happen anymore after HR1. So work requirements, that second piece, work requirements are being expanded. So a big piece out of the federal legislation that's coming down is work requirements. You're going to hear about it on the SNAP side. You're going to hear about it on the medical side. And the federal government is doing things to make this, in my opinion, intentionally hard. So the SNAP rules don't match what you would get on medical, right? And they're doing this to make this confusing. They're trying to do this so that people have a hard time understanding this. So for us, the big change to our work requirements is that more individuals across Rhode Island have to participate in our work requirements. And that includes up to the age of 64. So prior to HR1, we considered anybody 60 and over on SNAP elderly. That was the way that the federal government defined it. Now they're expanding work requirements all the way to to age 64. Now, there's exemptions that can potentially keep people safe so they don't have to do these work requirements. But on paper, according to the rules, work requirements are being expanded all the way from age 18 up to 64. And instead of if you had any children in the households, 18 and under, now it's only if your children are 14 or younger in the household, are you exempt. So if your youngest child's 14 or over, you're in the work requirement, and all the way 18 to 64 are in the work requirement. Now, if somebody is disabled, somebody's currently working, we have information on that. They're not going to be required to participate in our work requirements, but this is what the federal government is mandating. Many of the work requirement rules are not going to come in and be affected until 2026. So we're trying to do our due diligence at DHS, keep our Rhode Islanders as safe as possible, but also give time for us to be able to make sure that our computer system is working properly, and time for customers to understand what's expected of them. So for the work requirements, we're doing our best. Not everything is final, but we're going to do our best to try to give people until early 2026 to not have to comply with those work requirements. Also at DHS and in SNAP, we have the standard utility allowance. So that's the third item on this. Our standard utility allowance is a way for DHS and SNAP to give a pretty big deduction, $844, to households if they're paying for things like heating and cooling. So in the past, everyone pretty much got a standard utility allowance. We applied it. If somebody said, yes, I pay for heating and cooling, we would give it to them. Or if they didn't pay for heating and cooling, we could actually give them a small payment of $20.01, and then they'd be able to take advantage of this big deduction so that they could get more SNAP. So what's going to happen with the standard utility allowance is in November, if there is no elderly or no disabled individual in the household, and elderly in this case is 60 or over, nobody is elderly, nobody's disabled in the household, the household will have to show to DHS that they're actually paying heating and cooling. So again, if there's no elderly or disabled member in the household, I'm sorry, Deb?
I just want to interrupt real quick. That goes into effect on what date again?
On November 1 for standard utility allowance. Yep.
Next month. Got it. Thank you.
Yep. So customers are going to receive a letter next week that gives them overall understanding of these changes. And then if a customer is affected or a household's affected by this, like we don't have information on their standard utility allowance, the week of October 20th, they'll receive a benefit decision notice, which is a standard notice from DHS saying your benefits are going down or your benefits are closing. You have 10 days to tell DHS if you think this is incorrect. So that will go out on October 20th. So that's our first date. That's really important. Customers will get a notice right around October 20th. The first round of changes will hit on the standard utility allowance on November 1. And again, that's only if the household does not include somebody that's elderly or disabled. If the household includes just one person that's elderly or disabled, they're pretty much held underneath the old rules. But if nobody in that household is elderly or disabled, they'll have to prove to DHS that they're actually paying a heating or cooling cost. And that's going to be the big change in order to take advantage of that standard utility allowance. So that's the big change, and that's the one that's coming as the fast one, unfortunately. All the other ones we're trying to hold off until 2026. So that standard utility allowance, they have to show to DHS, yes, I'm paying for heating and cooling. If somebody is in subsidized housing and they pay $25 a month to run an AC, that counts. So show us that lease that says, yep, Kim is in subsidized housing. She has the option to pay $25 a month in the summer. Kim says, yes, I am paying for that option to use air conditioning in the summer of $25 a month. That will count so that we can give them the standard utility allowance so that they can have that deduction of $844, which means that they get more SNAP. So if we enter a deduction into the house, less of their earnings is counted, more SNAP that they get. So we want to use that standard utility allowance because that equals the deduction so that they can get more SNAP. So that's why it's really important for our customers. There's an internet expense thing that changed in HR1 that doesn't affect Rhode Island. We didn't have that as something that we utilized here. And then there's some administrative changes. So there's going to be costs that the department has to pay now in order to run the SNAP program. So matching funds, depending on what the Rhode Island's error rate is, which is a complicated way in which the federal government kind of like rates our program. Depending on what our error rate is how much DHS would have to contribute or how much Rhode Island would have to contribute to run our SNAP program. That's a really scary number, and we don't know how that's going to work right now. So what that means is that if Rhode Island does not become more efficient in running our SNAP program, and many states across the country are not efficient running their SNAP program, we could have to pay millions upon millions of dollars to run the SNAP program in Rhode Island. This is the way that the federal government is trying to get us to switch off of an access-based SNAP program, which is we want to get as many people accessing this program. And the federal government is using money and payments and penalties to switch states to be very constrictive and very punitive on our SNAP program. So we're trying to weigh taking care of Rhode Islanders and doing everything we can to provide supports on SNAP and meeting these very strict requirements the federal government is imposing on us for HR 1. So what that might look like for customers is we might be asking for more verification or more documents from them. That is something that we are likely going to do. We're going to be asking for leases. We're going to be asking for proof of heating or cooling, medical expenses. We need to see those expenses in order to make sure that we're doing what we're supposed to be doing and meeting those requirements of the SNAP program. So that's what our matching funds requirement means under 10105. Administrative cost, it's going to cost every state across the nation, no matter how good or bad we are at administrating our SNAP program, a lot more money to run it. So for every dollar we spend in SNAP, the federal government right now gives us 50 cents. So if I spend $1 million on my SNAP program to run the program on an administrative level, right now the federal government gives me $500,000. Starting October 1 of 2026, the federal government will only give me 1/4 to every dollar. So if the state of Rhode Island spends $1 million to run the SNAP program, the federal government will only give me $250,000. So that's, again, more administrative, less affecting the customer, but this has an effect on the program altogether. Rhode Island has a nutrition education program that we run. It's run through the University of Rhode Island. You might have seen them if you're out at farmers markets. Sometimes they're in local grocery stores. They've come to senior centers many times, in which they try to send educational materials out so that our users, our elderly, our customers can get the most nutritious food, the most food within their SNAP budget. And so that program has been cut. That will only run for about 8 more months. The federal government is no longer paying for the SNAP nutrition program anymore. We are trying to get creative and make sure that those resources are still available to Rhode Islanders, but just not being able to be paid for underneath the SNAP program. So we're going to do everything we can to make sure that either through the food bank or through our CAP agencies, through our food pantries, we can still get that information out. But we're not going to be able to do it through our URI contract anymore. And then the very last one listed on this slide, I know there's a lot on the slide, is the 108, is those that have immigration status that are mixed, immigration status that is unknown, or specific immigration status may need to give DHS more documentation, or they may not be eligible for SNAP altogether. So let me give you a couple of examples. And Jill, I'll answer your question in just a moment. On the immigration status, if an individual is a refugee, an asylee, a parolee, a humanitarian parolee that is not from Cuba, Haiti, or COFA island regions, they may not be eligible for SNAP unless they've met a 5-year bar. So that's what the federal government has mandated to us, that they are saying that certain immigration types are not going to be eligible for SNAP without waiting for 5 years. So what we're doing right now is we're going through those individuals that have statuses that we are being told from the federal government are no longer eligible: refugees, asylees, parolees, some humanitarian parolees. And we're trying to see if they've been in the United States lawfully for 5 or more years. If they have, they're likely going to be able to keep their SNAP. If not, we're going to ask them if they can provide documentation of the date they entered, which is typically called their I-94 immigration paperwork. If they have that and they've been in the United States lawfully for 5 years, they're likely going to be able to keep it. If they are in one of those statuses that are no longer eligible and they have not been lawfully in the United States for 5 years, they will likely lose their benefits for SNAP. Now, if there's 5 people in the household and only one person falls in that category, 4 people are going to stay on. It's just that one person comes off the benefit. The difficulty here is that if they're working, because many of them are lawfully working, their income does count against that household. So it kind of feels like a double-edged sword here, that they don't fit the immigration status to be eligible for SNAP. They don't receive SNAP for themselves. But if they are working, and many of these individuals are lawfully working, lawfully paying taxes, their income still counts against their case. So that household's going to receive potentially $100 less in SNAP, $80 less in SNAP. It's definitely going to be a hit to those households. There was a question. How can I answer you that question, or how can I help?
So Kim, I just want to let you know that, so we're doing the Rural Health Transformation Program. So I put a thing,
Yes.
a link in the chat. Okay. So we are still submitting proposals. There is a link to do that. So we are looking at all this from a rural transformation perspective.
Yep.
But if you want to submit something, we'd be happy, to entertain that.
Are you over at the Department of Health?
Yes.
Okay, so I talked to Sandra Powell about a week ago, and I'm trying to get her a streamlined kind of like 2-pager on this. I'm going to finalize that hopefully today, if not tomorrow. Do I send it to Sandra? Do I send it to you?
You can CC me. I am the state office of rural health manager, but yeah, Sandra's great. And we will definitely entertain all these. That's what we're trying to do. And, Deb's presenting, next month? I think November. So Deb's going to present next month, about
Perfect.
the elderly stuff. But Kim, reach out to me if you need it.
You got it. So as you can see, the federal government is making this complicated. They also put out some grants at the same time, and we're trying to see if we can, make sure that some of the restrictive things that are happening in SNAP, could we actually help the same or similar populations have an expansion through a rural health grant. So we're working through this amongst many different departments at the state all at the same time. I'm going to keep moving just for time. I know this is a busy slide. I have it broken down in a couple different other areas. So this slide is also speaking to ABODs. So ABODs are our work requirements. It's this horrible acronym the federal government came up with. It's called an able-bodied adult without dependents. We just received information. So as you can see from the slide deck, there's some areas like immigration where we've received very little information from the federal government. And then there's information still coming in just 5 days ago from the federal government that we're still kind of trying to do legal analysis on. But some of the things that are coming in from the federal government is that those ABODs, or those work required individuals, in the state of Rhode Island, we have certain cities and towns that have been waived. They have not been required to participate in our work requirements for 15 years, right? Because there's been these ongoing rules and laws that has not made certain cities and towns have to participate. As of just last week, the federal government is saying there's going to be no more cities and towns that are waived unless they have an unemployment rate at 10% or higher, which is very unlikely. The unemployment rate for almost every city and town, every county, even across the whole nation, for the most part, is well below or at 5%. So what they're basically doing is they're saying no more cities and towns are going to be waived from these work requirements. So we just got this information. So next year, not now, next year in 2026, Charlestown, Central Falls, Foster, Johnston, New Shoreham, which is Block Island, Providence, Pawtucket, West Warwick, and Woonsocket will lose that waiver, and for the first time in more than 15 years, will be subject to our work requirements. So again, between the ages of 18 and 64, individuals would have to be volunteering, working, participating in an education or training program, or exempted. An exemption is pretty broad. If the community or a member in the community that they work with says Kimrush is not work eligible, work ready, we have an online form, a form that the community member can fill out for that individual. They submit it to DHS once per year, and we can exempt them. We can waive the work requirements. So all this information, some of this is still coming in from the federal government. We are trying to figure out the implementation time. Right now, we're expecting it to be 2026. That might change, but right now we're expecting it to be 2026. So these work requirements are going to come in, not only for the individuals that are mandatory work registrants, are ABODs, and then that's expanding to the 18 to 64. Deb, I want to answer your question.
Yeah, in the past, the work requirements, if they applied, those work requirements exempted the 55 to 64-year-old population.
Yes, they did.
Is that going to remain the same, or has that
No.
changed?
This is the change. So they're no longer, that 54 to 64 is no longer exempted. So if that person is disabled, they will be exempted. If they are going into the community, if they're receiving Meals on Wheels, if they are seeing their doctor on a regular basis and are clearly have medical things that would prevent them from participating in these, they can fill out a form and return it to DHS once time per year, and we can exempt them from the work requirements. So those forms are already on our website. We have to do a couple changes to them, but they are on our website. They're good. They're valid. We're going to set up quite a few different community-based meetings where we walk people through those forms as we get closer to the 2026 deadlines. But we want to make people aware the rules are changing. More people have to do these work requirements, including all the way to age 64. But we're going to try and we're going to do everything we can to keep those broad exemptions or these broad community paperwork, community exemptions in place as much as possible so those individuals can continue to keep receiving their SNAP and not do more than that they're already taking on. So we'll go through that a little bit, but this is the world that we're in with our work requirements right now. This is the change that the federal government did put on us. So especially for Providence, Pawtucket, West Warwick, and Woonsocket, there are going to be people that might be on SNAP for 20 years and say, I don't know what you're talking about, 15 years. I've never had to do work requirements. They're right. They've been waived this whole time. So this is the first time that they're ever hearing about this. If they are a single individual, they don't have a child that's 14, that's under the age of 14, and they have not had to do this on SNAP, this is going to feel very new. They're not going to know what we're talking about. This is brand new to them because they've been in a wave city and town for more than 15 years. Those are the individuals that are going to have to participate in these programs. And for these work requirements, they have to be working and at minimum 40 hours per month. Or they have to be volunteering in an education program or in a training program for a minimum of 80 hours per month, or they need to be exempted. They're working with a medical professional or a community member that says Kimrush is not fit for work. There's a lot going on in Kimrush's life. I'm going to fill out this form and make sure that DHS has a copy of that at least one time per year. We've done some rough numbers about how many individuals have been affected. So it's about 13,000 individuals. The dollar figure, that $17 million, is if we were to take action immediately, if we were to do everything on November 1, the state would lose over $17 million into the economy. That's how much in SNAP goes out the door to these individuals. We're not trying to do that all on November 1. The standard utility allowance is the one that's going to hit on November 1. Everything else is going to happen in 2026. That's our goal. That might change, but we're doing everything we can to hold to that. And it's going to affect at least 14,000 individuals. That city and town waiver could be another 4,000 to 5,000 individuals, but we're not 100% sure because we just got that number 5 days ago. So this is a big impact. There's a lot of people, their standard utility allowance is going to be reduced. That's at 10,000 people. They could lose their SNAP altogether if they don't get their standard utility allowance. That's 1,000 people. New ABOD requirements, it's about 800 people. And then our citizen group, that's about 1,200 people. So all of these notices, about 13,000, 14,000 notices are going to go out next week, just telling people you're subject to these changes, right? We're not sending the notice to everybody, just those 14,000 are going to be affected. If their standard utility allowance, if they fall within these buckets, they're going to receive another notice right after that called a benefit decision notice. It's a standard notice in DHS. On the first page, it's going to say your SNAP benefits are being reduced, or it's going to say your SNAP benefits are closing. Flip to the second page and read on the second page what is happening to those benefits. If it's an individual that receives many different programs, it might say your benefit is going up here. Let's say in Rhode Island Works, if they're taking care of grandchildren and they're on the Rhode Island Works program, the front page might say your Rhode Island Works is going up. Flip to page 2, the Rhode Island Works is going up because their SNAP is going down. You got to read that second page. In about a week and a half, we're going to put a copy of what that notice is going to look like on our website. All right, so we don't have it quite yet, but we're going to try to get that out on our website so you can see what that notice looks like in about a week and a half. Here's some other numbers. It's very important to talk about how critical the SNAP program is for Rhode Islanders. We pay and we have benefits go out into the community of over $350 million per year. So even a small reduction, $17 million per year, about people losing their SNAP benefit, that's going to affect our economy. That's going to affect how people eat. So that's what this goes through. And so we're looking at just kind of what is our SNAP program in general. In the end of our last federal fiscal year, which was September of 2024, we had about 145,000 individuals on SNAP, about 91,000 households. Our average monthly SNAP distribution is about almost $29 million for a total of $347 million that goes into the economy in Rhode Island every month just because of SNAP. So these changes are going to create constrictions or reductions all across the board. This is some of more of that fiscal and administrative items, when things are going to be happening, what the cost to the state is to implement these. We're looking through our processes, our procedures. We're going to be training community, training staff. We're going to be talking about the people affected and then how we do these changes and what that's going to look like. And we're working through some of that right now. And then we're looking through all of our different contingencies. We're working with the food bank. We're working with our nonprofit partners, our CAP agencies, our pantries. We're trying to come up with additional resources for customers. If they have their SNAP reduced, where can they turn? How do you sign up for LIHEAP, which helps you pay for heating? If your SNAP is reduced, you're going to have less money to feed yourself. You're going to have less money for utilities. How do you go out and get utility help? How do we challenge our error rate? Our error rate is how the federal government weighs against, are we running a good program and not running a good program, right? And so there's some other items in this deck that really just talk to the administrative burden. But I'm going to stop there and try to answer some questions. And I will drop and leave it to my partners here to give you some information on the medical changes that won't happen until next year and hopefully answer some additional questions for you all. So what can I help you all with for questions? I am going to put my email in the chat. And I unfortunately have to drop for a conflict, but my partners are here as well. Please feel free to reach out to DHS. We are going to be doing community level meetings like this on Zoom, some in person through the next couple of months. If you email me and you have a standard meeting, let's say the first week of November, you always have a good meeting with a good group of folks, and you would like somebody from DHS to come and talk about these changes, email me and we'll get you on that list. And so that we can either send somebody via Zoom or send somebody in person to try to help do something similar like this, give you some more information, come in with some of those examples of notices and provide those resources for you all. I really appreciate everyone's time today.
One really fast question.
Yeah, of course.
If there's one thing that we can communicate to the people that we serve particular documents or something like that, what is that message that we should all be saying? Like, keep your utility bills, get your leases,
Yep.
like.
So for this population, one, open your DHS mail, respond to it as quickly as possible. You get a lot of mail from DHS. A lot of it is FYI, right? This is the time. Don't put that in a corner and say, oh, they send me so much junk. I'll look at that later. Open those. Make sure if you don't understand what it says, go to that community partner, ask for help, call DHS if you need to. We're going to have some drop-in sessions where people can come and just ask questions. We're going to be working on setting those up as well. And the goal is open that mail, keep those utility bills, drag out that lease that says that you pay $50 a month in heating and cooling, get copies of that to DHS, make sure DHS has your correct phone number and correct address. That's the most important thing right now. Open that mail, respond to it as quickly as possible. If I get that in on a Monday, you want to get that information to DHS, either put it in the mail, show up at the DHS office, get it to us as quickly as possible. If we're asking you for documents, go ahead and send us what you got. It's better to send us stuff than to say, I don't know what they need. I don't know what I should give them. Send in what you think we want. It's better to do that. It's more likely you're going to stay on than if you don't respond to us at all. If you close, you could be subjected to some of these new rules sooner. You don't want that. You want to be able to wait as long as possible.
And that would be make copies of those documents that they're sending in, just in case something gets lost.
You got it, 100%. Thank you all very, very much for your time today.
Thank you.
I appreciate it.
Thank you so much. And our next speaker is Rose Leandri to share about the changes coming from Medicaid. Also, just so everybody is aware, when you close out, you should receive a quick survey. We need to identify for potential funders the value of holding this every month. Are you finding it helpful? Are you learning things? That kind of thing as we apply for grants. Now, there you are, Rose. All right, Rose Leandri from Department of Human Services. Welcome, Rose.
Hi, good morning, everybody. Deb, is there a way I'm able to share my PowerPoint?
Yep, if you hit share at the bottom of the screen, I'll get a note that I should be able to give you the ability to do that.
Okay. Moving from, let's see.
Right at the bottom of the screen.
I see it, yes.
And I should get a message on my side. There you go.
Hi, okay, let's see. And I think I want to go into presentation mode, right?
Probably.
Oh.
Slideshow?
Okay.
I don't know if that'll autoplay it or not.
I think we did it. Did we do it?
It looks like it's clocking on your side.
I can see it on my side. Can you all see it?
I can see it. Can everybody else see it? Just give a thumbs up.
Okay.
Folks can see it? Yep.
Okay. Good morning, everybody. My name is Rose Leandre. I'm the Associate Director for Medical Services with the Department of Human Services. I oversee eligibility for the Medicaid and the LTSS programs at DHS. I am joined with my colleague, Kim Martinez, who's the Assistant Administrator for Medicaid and LTSS. Kim, if you're here, I'm not sure if you're on screen.
Good morning.
Okay, yeah. All right, so I'm going to skip to a few slides that talks about a little bit about DHS. I believe my colleagues may have gone over it, and I'll jump right into Medicaid. Okay. So before I jump into the specific of Medicaid related to elders, adult, and disability, I just want to give a bigger overview of the Rhode Island Medicaid program. Essentially, we let individuals know we have 5 major pathways. So if
Rose, I
you're
want to interrupt you real quick.
yes.
We are on the first page of your PowerPoint.
Oh,
PowerPoint did not
okay.
advance.
It did not advance. It's advancing for me. Okay, next slide. Huh. Let's see. Okay.
And if you want, you can always share it afterwards, and I can send it out to the participants
Okay.
if we can't make it work.
Let's see. Try again. Okay.
Rhode Island Medicaid today, eligibility categories.
Yes.
Okay.
Okay, I think you're not going to be able to see it in a presentation screen, but essentially for Rhode Island we have 6 different categories that you're able to access. So if you're a family with children, you can access it through, and the requirement for families with children is if you are a pregnant woman, your income is below 253% of the poverty level. If you have children under the age of 18, income up to 133%, the adult would be able to be eligible. Children under the age of 19, income up to 261% of the poverty level, depending on where you are. So for the family coverage, you could have a parent not eligible, but the children is eligible. Essentially, if you a family with children, one or all of the members of the household could apply for Medicaid and be eligible based on where the income criteria is for that family. The second group is what we call our expansion group under the Affordable Care Act. Is for individuals who are between the age of 19 and 64. And for those individuals, if your income is below 133%, there is no resource limit, you could be eligible to access Medicaid. The third population, which is more in alignment with what Rhode Island Elders program does right now, which is the elders and adult with disability population. So for this population, if your income is below 100% of the poverty level, there is a resource limit. We call that the complex population. There is a resource limit of $4,000 if you're a single individual, $6,000 if you are a couple. And under the same category, we'll talk a little bit about LTSS. But essentially, the resource limit is the same once we start going into the more into the complex category as well as LTSS. So if you're an adult below the income limit, the resource limit, and you don't have a complex need for LTSS, you could still access Medicaid eligibility under what we call our community Medicaid program. Now, if your income is above the 100% and you're an adult with disability or an elder, we start looking at different options for you. So we start with what we call our flex option if you have medical needs. If you have medical needs, we look at, okay, how much is your income over the 100%? Then we assess what we call a spend down. As long as you meet the spend down, then Medicaid is able to cover your medical needs under Medicaid if you're for whatever's above 100% of the poverty level. Then we go and we look at, okay, if you're an adult your income is above 100%, you have medical need, you are working disabled, we have what we call either ticket to work or Sherlock that you could access. Still not with LTSS yet, because as you'll see further on, LCSS requires that the individuals not only being disabled or age, they also have to meet a clinical level of need. So we do have a lot of individuals who may not meet the LTSS eligibility based on clinical, but could benefit for just regular community Medicaid and may be able to access preventive, which is like just basic 6 hours of support services, or you could access Medicaid if you are working disabled. You could access Medicaid under or either ticket to work if you're between 16 and 64, or if you're over 64, you could access the Sherlock program. And the premium is based on income on a sliding scale. I do have that information that I can share afterward. Once you've gone through the different pathways as an elder adult with disability that I discussed, you still have needs that are beyond just community Medicaid, then we can transition to LTSS. But before I jump into LTSS, I just want to touch a little bit about the other category, which is for our special population, children with special health care needs, emergency Medicaid. So you may not be eligible for the 3 categories that I discussed before, but if you end up in the emergency room, Medicaid may be able to pay for that medical related expense for that emergency room visit. So we want people to be aware of that. And then we of course have a right share category, and it's essentially for the folks in the first category, family with children, or the expansion category, but they have employer-related health care coverage. So you're paying your employer for health care. Medicaid may be able to cover that for you. So you want people to be aware of the different pathway that you're able to access Medicaid. I'll stop here before I move into further into the requirement for the EAD as well as the LTSS population. Keep going? Okay.
Keep going. There we go. I was going to say we hadn't seen the slide, but there we go. We're good.
Okay.
And the changes that are coming. Oh my.
Okay. So the elders adult with disabilities, we have like, if you're on SSI, you would automatically be enrolled in our Medicaid program under the SSI pathway. So we receive a file from SSI every month that tells us who are currently receiving SSI benefit, and they are enrolled in the Rhode Island Medicaid program. I talked a little bit about if your income is below 100% of the poverty level, you'll be able to be eligible for a regular community Medicaid. If the income is above that, then we put you into our flex category, and then you go into our LTSS category. Talk a little bit about ticket to work and Sherlock, because we think that a lot of folks who might be receiving income, even if you're doing very minimal work while you're disabled, you could now access either ticket to work or Sherlock. 16 to 64 for ticket to work, Sherlock over 64. So we want you to remain active in the community and not stop working because you think like you might lose your health care benefit. And that ticket to work in Sherlock also extend to folks who are receiving LTSS. So you could be getting support in the home and still be active in the community working, and you'll be able to choose either regular LTSS or LTSS ticket to work or LTSS Sherlock. Okay. So for our LTSS program, as I said before, you meet the regular Medicaid requirement, but for LTSS, you go through what we call a determination of level of care. So we have, if you're going to be receiving LTSS in the community, we have social workers go to the home, they do an assessment, and we collect medical information. and it gets reviewed with the nurse to determine whether or not you meet the level of care to receive long-term services and support. The difference between community Medicaid and LTSS is you have to show that you have a disabling condition, a healthcare condition, a cognitive delay, developmentally disabled, and that condition impacts your ADL and IADL. So your activities of daily living, you need hands-on support and assistance. The other piece of it has to be a overextended period of time. It cannot just be short term. It has to show that that need is a long-term need, and we look at that beyond 12 months. Once you've been determined level of care, you're able to access LTSS either in the community setting as part of our shared living program, in an assisted living, adult day program, and the final option, which is an institutional setting, which is our nursing home. For LTSS, there's not a strict income limit. We let folks know if your income is below what we call the nursing home reimbursement, which is about $10,000, you could be eligible for LTSS if you meet the financial criteria with the resource and you meet the level of care. What we do is we ask that you pay what we call a cost of care to either the home care agency or the assisted living or nursing facility, and then the state will will reimburse either the home care agency, the assisted living, the nursing home for the additional services that they are providing to you. So even if your income is below the poverty level and it's up to about $10,000, we could still cover LTSS for you. You'll just have, the closer your income is toward the $10,000, the higher your cost of care is. For individuals who are in the community, if their income is below what we call 300% of the poverty level, they have no cost of care. So I think today the 300% is about not 300% of poverty level of the federal benefit rate. Today, the federal benefit rate, I believe, is $900 and change. So if your income is below $2,900, you do not have a cost of care. I think that's all I have. Want to talk a little bit about timeliness. When we receive a Medicaid application, if there is not a clinical requirement, so you're not going for our MART determination, you're not going for a level of care for LTSS, we are required to determine your Medicaid application within 30 days. For those that require a clinical eligibility determination, then DHS has about up to 90 days to make that determination. Quick about recertification. We had stopped recertification during COVID time. We have since resumed recertification, and we want people to be aware that once you become eligible, unless you fall under our SSI population, you get renewed every 12 months. Today, under Medicaid, whether it's community Medicaid or LTSS, you are renewed every 12 months. What we do is, in order to streamline that process for individuals, we have what we call passively renew or actively renew. We use approved interfaces. So if our interface has a match, there's not a big discrepancy with your income and resources, and you are eligible, we would passively renew it. If we receive information that may deem you ineligible, or there's a huge discrepancy in what we currently have and the changes that occur from your financial need, then we send you a packet and ask you to sign it and submit it back to DHS so that way we can renew it. You have about 45 days to return that packet. It's very, very important that packet is returned to DHS by the deadline. So I just want folks to be aware of, and that eligibility is based on the start date. So we could receive an application in January. We determine it in February, for example, for LTSS, and the eligibility start date is January. So your renewal will be up January the following year. So please keep that in mind, because we have a lot of folks where services may be disrupted because maybe they weren't paying attention to mail and did not return that recertification. So I really want to make sure people are aware that today we do recertify. I'll stop here and then I'll talk a little bit about the three main impact of the HR1 to come for Medicaid. Any questions? No? Okay. So there's a lot of changes that are
Rose, a question came
was
up in the chat. What if you get approved for LTSS in November or December? Do you still have to reapply?
you don't reapply, you recertified. So recertification, we send you a packet in the mail, and we also have access to the blank form. You don't submit all of the documents that you've submitted during the brand new application, but you have to recertify. And that, as I said, if you're receiving SSI, you're exempt from recertification. If you're not receiving SSI, you're receiving RSDI or SSDI or regular income, you would be receiving a packet in the mail for folks who are going through a passive renewal. You don't receive a renewal packet, you receive a benefit decision notice. So good question. So if 12 months from your determination date, you don't receive a letter from DHS saying, hey, we've automatically renewed you for another year, or here's a packet to fill out to return, I would encourage you to reach out to DHS just to make sure that for whatever reason, you didn't miss your recertification. We also have, for folks with access to internet, we also have a way that you can check to see if a recertification was sent out to you. And it's Covered RI is the website. So you're able to go there and put in your information, and you can see when your recertification date is.
And Rose, that's 12 months from when you're approved. It's not if you were
Not from
approved
when
in
you
November.
approve.
It's not like January. You got to do it all over again. It's 12
Not
months from.
Not from when you approve, from when your eligibility dates start. So
Got it.
for
Okay.
LTSS, we have 90 days to make a determination. So if your application came in January, we could be determining it in February or March. So, but when we determine it, your eligibility is going back to your application month, which is January. So
Got it.
your
Okay.
recertification is not from March. It would be from the date that we say your eligibility starts. So the letter would say you are eligible from January 1 for 12 months. So then your recert date, you should be getting a packet in the mail from us around like November, because we send it in November and ask you to return it by December 15th. We have a 15-day buffer. We ask folks to return it within that 45 days of that packet, not wait till the last day of the month.
Got it.
Any other
Thank you.
questions? Okay. So there's, as I said before, there's a lot of changes to the recent legislation. And from a Medicaid perspective, there's a lot of research, internal conversation, review that is happening on our side, a lot of pending final ruling from CMS to come to the state to let us know how to implement. So we don't have a lot of extensive detail related to how this is going to look like. The only thing I can provide today is just 3 high-level bullet points. There's a lot that is specific to how Medicaid operate that may impact customers indirectly, but the direct, clear line from the HR1 to customers are these 3 main requirements. We're still waiting for guidance on how to implement it. We know it's the law, but we're still waiting for CMS to let the state know. And our understanding is so some of those take effect October 2026, which is a little bit different than what my colleagues share, where SNAP is some of them are happening this year. For Medicaid, they start taking effect October of 2026. We're hearing from the federal government. We'll get some guidance sometime next year. So we're looking at our internal data, our internal practices to see how wide the impact. There is a stakeholder meeting that happens. I didn't bring the dates. I'm not sure if my colleagues share those dates, and we can send them to you, Deb, where the secretary, the governor, and all the different state agencies impacted, DHS, HSRI, Medicaid, EOHHS, they hold a meeting where they're constantly updating the community about where we are and some of the different activities that we are doing to become compliant. There was actually one yesterday, so Deb, I'll share the information for anyone who's interested in attending. But from the population that Kim and I are reviewing right now, the direct impact that we are embracing for is 6 months renewal. I talked earlier about 12 months renewal. Again, this is not fully implemented, so if you apply today, as far as we know, your renewal is 12 months from October until further notice, because we're not sure whether this is going to be moving forward, if they're going to have a cutoff line. So as of today, whoever applies for Medicaid, your renewal date is 6 months, and we either do it's 12 months. We either do passive or active. The 6 months, it's what's in the regulation. Hoping to be implemented in October. We don't have guidance. Once we have guidance, we'll be happy to come back and collaborate with Deb and others to kind of share of how this will be implemented. The thing with the 6 months renewal, they are allowing state to have exemptions. We are still waiting to get very, very clear on what the exemptions are, but what we know, if you have a disability, you could be exempt from the 6 months renewal. So we do think that the LTSS and the complex, not clear with the age, but if you have a disability, again, we don't know how deep the detail. You could have a disability, they could have threshold, but right now they said folks with disabilities could be part of the exemption from the 6 months. From the 6 months renewal or community engagement. So we are waiting to get more guidance on that. We think that the 6 months renewal, remember the previous slide, we talked about the different population, mostly the ACA, and adult with no children between the age of 18 and 64, not disabled. We think that could be the population being mostly impacted. Again, we're waiting for further guidance. The community engagement, similarly, they are asking folks on Medicaid, part of the new HR 1, you'll be required to either have hours of community volunteer or actively working students. So there's a whole list of very clear list of what we think would follow the community engagement requirement. We believe that it will be similar to what the ABOD rules that my colleague Kim spoke earlier. Again, we're still waiting for guidance. What we hope as a state, as much as we can align those requirements, if they are being required for one program, SNAP, how much can we align them so folks don't feel that they have to meet one requirement for SNAP, one requirement for Medicaid. So as an agency, we are working together to review where the similarities are in those proposals across programs to see how we can streamline and where we're able to request exemption to the federal government to allow us to streamline cross-program impact. We are looking to see how we can do that. The immigration requirement, we believe, is very similar to some of the SNAP immigration requirement that my colleague speak of. I really just want to give you a 3 high-level heads up, and my apologies, we don't really have very clear detail as SNAP may have right now, because we know the regulations, but the actual how to implement it, we have not received the guidance from the federal government. I'll stop here for folks with any questions. For the community engagement, there is the waiver. Folks with disabilities, I don't want to say 100% right now, I can, but we are close to feeling comfortable that the LTSS population from the both renewal and community engagement may not be impacted, as well as individuals who are part of the Affordable Care Act, the expansion 18 to 64 population. And we are coming up with how to define disability. We talked about the community Medicaid population, where you could be aged but don't have a diagnosed disability like a review from SSA. So you're receiving retirement benefit because you're over 65, but you didn't go through a disability review, whereas some folks are getting SSDI because they went through a disability review. So at DHS, we do have what we call a medical review team, like a MART unit. So for individuals who could be, if let's say we get guidance, if you're 65, you're not considered disabled, even if you're receiving RSDI retirement benefit. Those individuals could go through our MART review to see whether or not they could be disabled, they could be deemed disabled, thereby waiving some of those requirements. So we are looking at resources we have internal, especially for disability determination, because we do know a lot of individuals could be on our community Medicaid program where, they have their income is below 100% of poverty level, but they have not gone through the process of receiving an SSA disability determination. And if those individuals are not waived, how can we work to make sure that they are still access Medicaid if there is a disability that can be reviewed through our state resources? So we're looking at that.
Rose,
Any questions for me, Deb, or any others?
We've run over, and I appreciate that the vast majority of people have stayed on. It just speaks to the importance of this. Mm-hmm. As we face our clients, what are some of the key takeaways what messages should we be communicating with them in addition to open your mail?
Yes, I was going to say that's what we're saying right now is please, I know all of us we get so many mails. Open your mail, and for folks with access to computer, I know there's a lot of agencies, a lot of groups, they're helping with, helping folks to become more proficient in using computers, electronics, phone, text, anywhere that's providing training around. I know my mom struggled to send me texts, using your text, because we have these different ways of notifying individuals. With DHS, you can opt to receive text services to some of our messages. So if you're someone who really doesn't open mail and you're able to sign up and create an email account, access our portal, so we have a way to folks can, resume their account and access and be able to go in there. If you're comfortable with your phone, you can sign up to receive text messages, because a lot of those changes, before they get implemented, we plan to use all different methods of communication. So as much as you're able to work with different support systems, Deb and others who are supporting community members in addressing barriers, whether it's electronic barriers or opening mails. We are also at DHS. I'm not sure if my colleague, because I came in a little bit later, we are partnering with the Association for the Deaf and Hard Hearing, where we are really beefing up DHS's resources to better serve that population. So we're looking at different ways that we can support communities that are underserved. And whether it's from an income-based, disability-based, region-based. Once someone on the line talked about the new federal grant related to remote communities. I am part of the group, and one of our proposals is to try to see how can we, as an agency, partner with different programs to go to different communities. So we are looking at how can we make sure we increase access to our services for individuals. But definitely open your mail, sign up for any type of electronic system that you're comfortable with, so that way you can be in communication. I also added our contact information here for the Medicaid and LTSS team at DHS. You're welcome to reach any of us if you have any questions.
And I know that somewhere, and I was just trying to find it quickly without success, I know somewhere that there is a video that EOHHS has done that provides how to go online and set up those things. So I will try to find that. I sent it out in one of my more recent newsletters. So hopefully everybody's subscribed to our newsletter.
Yeah. And Deb, you're able to reach out to our deputy director. We do have someone who provides that customer portal training. So if you wanted to have us do something similar to that, we're able to do that.
Absolutely.
Yes. All right. Well, thank you, everybody. I hope this information was helpful. I know it's a lot. Stumbled a little bit in the beginning, trying to make sure I'm not giving you too much. It's always trying to figure out how do you make it as simple as possible when, this could be like a 200 page presentation. How do I make it into like a 7-page presentation?
I
So
appreciate
thank
you
so
coming
much
on,
for your
Rose.
time.
This has been very helpful.
Okay. Thank you, everybody.
Thank you. And for everyone who has stayed, I am greatly appreciative. We have stayed over in time. And I appreciate you staying. You should get a pop-up of a quick survey of whether or not this was helpful. Did you learn something, etc. Our funding to host community collaborations at the moment is set to end in December. So I am applying for funding to keep this going. I'm applying like mad, but part of what funders want to see is what is the reach, what is the outcome of holding this. So please, when this closes out, there should be a quick survey, super short. If you could do that, I would really appreciate it. And I look forward to seeing everybody next month on the second Wednesday. Thank you all very much.
Thank you.
Thank you.